Skull. Try to fix this information first. When I have this like this is the whole skull of it, cranium. Okay, skull. If I remove this thing, this is known as vault, V-A-U-L-T, vault, and the remaining is known as cranium, or the cranial cavity. Inside is the cranial cavity. Okay, so this is actually the skull. How we will read it? We will read it in different ways. Number one, here is the front view, frontalis. Norma yani surface. Norma, surface. Frontalis, anterior surface or front. Lateralis on the side. Verticalis, when I see it from the top like this. Vertically I am seeing, so it is verticalis. Then I have occipitalis on the back with the name of the bone, occipital bone. Here, this is the occipital bone. I will identify you occipital bone on the back, so occipitalis. So here, frontalis, front, verticalis from the top, side view is lateralis, back is occipitalis, and here is basalis. When I say basalis, it has two parts, externa, interna. Okay, externa, interna. Interna is not with you at this moment. Only we will find and back there, base and okay. So Bismillah, let's start. Even better than this, let's start with this picture. Yes, here in this picture I have made the same colors, like frontal is the frontal bone, blue. Then parietal, this green, all this is parietal. Then we have temporal, red. This is temporal bone. Sphenoid, here. Sphenoid is here, sphenoid bone. Then we have zygomatic, this one. Then we have mandible, here. Then we have maxilla, here. Then we have nasal, one nasal, another nasal. Then we have lacrimal. Just go on a side of the nasal, you will find a lacrimal here. Lacrimal bone. Skull is not one bone. These are multiple small bones which are interconnected and they give you a shape. Okay? The different ossification can be different. If you make an X-ray of a young child, he may have, you don't think some bone is missing. It means it's not ossified. Okay? This is how we take them to start. So again, where are the bones? Which are the bones? Which is easy to... Yes. So here is the frontal group, then parietal here, temporal on the side here. I will in another view you will see. Sphenoid here, sphenoid bone. Zygomatic, zygoma means cheekbone, zygoma. Mandible, maxilla, nasal bone, and lacrimal. Okay, this is how we have certain bones here. Then, okay, go back. Sometimes this is the same, nothing new, except we have an openings, orbit, anterior nasal. This is all orbit. This is the margin, inside is the cavity to accommodate the eyeball inside. Then we have anterior nasal opening. Anterior nasal opening, anterior nasal aperture, both same. Sometimes we have a very special structure here in the middle. We have a suture. It's rare. If it persists there like this, we call this as metopic suture. And metopism is a condition. It is of course related to some other congenital anomalies, but still not very common. Once we have done with the bones, we have sutures. What is suture?
Between the
Yes, suture is a junction between two flat bones or two bones of the skull. Okay, these are thread, fiber, or irregular sort of bony margins. They have names depending upon the bone. Okay, So internasal, between the two nasal bones, internasal. Frontonasal, frontonasal. Oh, sorry, frontonasal here. Two frontonasal. Nasomaxillary. Where is naso? Here. Where is maxillary? Here. Nasomaxillary on the other side. Frontomaxillary. 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 Good?
Yes.
Zygomatico-maxillary. Zygomatico-maxillary. Good? Zygomatico-frontal. Zygomatico-frontal. Intermaxillary. Here we have one maxilla developing, another maxilla, they come in the center and they will make a junction here, intermaxillary. Okay? Why I am stressing upon the sutures? They are asked sometime in exam, theory, practical or somewhere. So again, internasal between the two nasal bones, frontonasal between frontal and nasal bone, lacrimomaxillary. I missed it. Lacrimo, this is lacrimo. Maxillary with here. Lacrimomaxillary. These are small bones which are connected with the help of fibrous type of joint. One bone, another bone, in between there is fibrous tissue. Make sutures in adults. In children, janine, in embryo, there may be some gaps because the bones are still developing. Okay? These are flat bones. You must be knowing that the flat bones, they develop from a membranous ossification. There is a membrane previously, then it ossifies. So it may happen that some of the bones are not even formed and only you can find membranes in the form of fontanella. I will tell you in a minute. Okay? Then there are other structures to identify. Superciliary arch. Okay, start from here. Glabella in the middle here. You know, in Indian movies they make a tilak like this. This is glabella here. This is the place of glabella. Tuber. Whenever you find tuber, it means elevation. So here, one elevation here, one elevation here. Don't be confused with these two elevations. Okay. Nasion. Nasion, junction of the two nasal bones. Yahi, no pen is working. I'm sorry. Oh, this is good. It's removable. Okay. Okay. Then we have nasion. Tuber means any elevation, not a very peaked one, a smooth big elevation like here, like here. This is like, see here, like parietal eminence or parietal tuber, parietal bone, parietal. I will come to it. Then we have nasion. Okay, orbit, margin and cavity. Here is the margin, inside is the cavity to accommodate the eye and eyeball and eye muscle. Then we have anterior bony aperture. Aperture means opening. Anterior bony aperture of nose. Inside the nose, of course, you have different structure. We will deal with them in the nose section. Superciliary. Okay. Here, just above the margin of orbit, there is another elevation, arch-like. This is superciliary arch. This is known as superciliary arch. This is the orbit, and then we have the cavity. Okay. Supraorbital, now foramens. One by one. Supraorbital foramen or notch. Sometimes just on the orbit, margin of the orbit, we have a separate foramen or we have a arch. Supraorbital foramen or supraorbital notch. This can happen. Depends upon ossification, of degree of ossification. It may be a separate foramen. Okay, what is foramen? Foramen is opening through which a structure can pass like this. This is foramen. Sometimes we have canals. Foramen is just through and through. Canal may have a pathway. So, if you have a wire or a flexible structure, it can pass. Of course, it's a canal, but foramen is like through and through. And canal, like carotid canal, is a pathway. Okay, I will tell you. So, supraorbital foramen or notch. I'm just telling you the names. I will tell you what are the contents subsequently. Then at the end, I have tables to show you the whole contents to make your life less miserable. Infraorbital foramen here. Zygomaticofacial foramen here. Zygomaticofacial foramen here. These are the foramens on the norma frontalis. I know the names are difficult, but still. Now can you identify some of the sutures? Yes. What is this?
Intermaxillary.
Intermaxillary.
Internasal.
Good. Here?
Zygomatic maxillary.
Very good.
Fronto-zygomatic. Or zygomatic.
Start with big bones first. Fronto will be good. Okay. Nothing new. Nothing new. Oh, I'm actually going back. I'm sorry. I said it's okay. Supraorbital foramen, infraorbital foramen, zygomaticofacial foramen. Content or related structure. I cannot explain. You have to remember. Superior orbital nerve and vessels, for example, they can ask you in the exam, what is this foramen? Name this. What is the content? What is the nearby structure passing? Blah blah blah. Depending upon the situation of the question. So, be ready. Yes, intermaxillary suture, you know it. Today we are not dealing with much of the theory, much of the things which are just to identify, because, and after that I will do it on the skull so that you can understand it easily. Again, what I have done now is glabella. Here glabella. Here with the junction of two nasal bone is yawn. Here superciliary arch. Here, okay, nasion, glabella, superciliary arch, margin of the orbit. Verticalis. Verticalis is from the top. Vertically is seeing a person. This is the view. In the norma verticalis, we have 1, 2, 3, and 4 bones. Frontal bone, of course, it's present in the norma frontalis, but still it's a big thing. So here, frontalis, 2 parietal bones, right and left, and then we have occipital bone. You can find some sutures here. The coronal suture, you know the coronal plane of the body. So coming from anterior to posterior, we have different planes. So coronal plane, coronal suture. Then you know the mid-sagittal suture. So sagittal, the word mid-sagittal is from this sagittal suture actually. Okay. Some books, some people say sagittal or sagittal, same. Here we have lambdoid suture. Lambdoid suture. This junction between this and this here. This junction has a name bregma. This junction has a name lambda. Sometimes in the suture, this is like here. Sometimes a suture can go and a small sutural bone can be identified. Sutural bone. For example, see here. This is a good suture now. Sometimes it is connected like this, and you can have this isolated very small bone. This is known as sutural bone. Bone in a suture. Sutural bone. If I have a picture, I will show you. Remember me. Okay. Clear up till now?
Yes.
Coronal suture, lambdoid suture, sagittal suture. Here two foramina, parietal foramina. F1, why this foramina here? To get what inside or get outside what? Emissary vein. Very good. What is emissary vein? Emissary vein. What is emissary? EMISSERY. Emissary vein.
Take a walk from skull to.
Very good. Here is the skull. Here is, for example, a foramen. very small. Here is the scalp, the skin and muscles of the scalp region. The venous drainage from here crosses through emissary foramen and go to some of the sinuses here. Drainage. So the venous drainage from the skin is crossing the skull and reaching here. What can happen out of it?
Bacterial infection.
Infections. If you scratch badly, you have infection and ultimately you have meningitis. So the venous drainage has drained the bacteria also inside. So this is a very important clinical issue regarding the emissary vein. Okay? Emissary veins are found in multiple areas, but this is the most common and mostly knowing area because we don't have any other structures nearby. So this is very easy to remember and very important to be asked. Okay. Now here, I told you the junction is bregma, the junction is lambda, coronal suture, sagittal suture, lambdoid suture, one parietal bone, another parietal bone, frontal occipital bone. If I have some sutural bone here, no. Eminence, elevation. See here, not smooth. This central area is smooth. Here we have another feeling of elevation. Here, this one. Here, this one. This is known as parietal eminence, like frontal tuber or frontal eminence. No problem. Same. Again, quick revision here. Sagittal suture, bregma, sagittal suture, coronal suture, lambda suture, lambda. Then we have, see, what I told you, they are developing bones can have some membranous structure in between. This gap and this gap, for example, these are known as fontanella. There are 3, 4, 5 fontanella, but the most important clinically are these 2 fontanella. This is known as anterior fontanella, this is known as posterior fontanella. Anterior fontanella is between which bones? Frontal and 2 parietal bones. And posterior is between 2 parietal and occipital bones. And rarely I told you this one, metopism, sometimes is persistent. So, anterior fontanella, posterior fontanella. The age, okay, why they are here? They are here because of, what is fontanella? Membranous area at the meeting point of skull vault bones in an infant. Importance, molding of the skull bone during labor. What is this? The vaginal canal is small. The head of the baby is big. So Allah subhanahu wa ta'ala has given the opportunity to molding. If they are gap, they cannot cross the vaginal opening. So they are fixed together or some degree of overlapping and then it's delivered. And after delivery, it becomes the same. So this is a very important point for fontanella for existence. So molding, this process is known as molding of the skull. Okay. Rhomboid shape, we have 2 important, anterior and posterior. Rhomboid yani like a diamond. Diamond shape or a square shape. Diamond is a very good description here. So anterior fontanella, posterior fontanella on the back. Of course, we have some fontanella here on the lateral and side, but they are not very much clinically significant. Why? Because we cannot palpate them. If you have seen a very young child in your family or somewhere, you must have find a small depression here. This is in children only. This is known as infants only. This is known as fontanella. The importance is 18 months of age, this will ossify and it will become bregma. Previously it was the depression, membranous part. Now it will become bregma. Site of lambda here, the back, it will become site of lambda and it is 12 months total. Clinical importance, progress of the growth. If the growth delayed, the fontanella remains soft for longer period. So this is one milestone while examining the infant. It is obvious in rickets or hypothyroidism. Degree of hydration. If this fontanella is depressed, the baby is dehydrated. If there is elevation on this region, it may be raised intracranial pressure bumping out. See this picture. I hope it will make you clear. See here, diamond shape. Here posterior. Here, see this depression. This is a real image of a child, showing depression of anterior fontanella. The baby is most probably dehydrated. If it is bumping out, this is raised intracranial pressure. And this is showing you the stages of molding, and then after delivery it becomes normal. This molding. Am I clear?
Yes.
Okay. Lateralis. Many bones here. Again, we will identify first frontal bone, parietal bone, occipital bone. So these are three big, very clear bones. Then we have temporal. See temporal here, flat part of temporal bone. Even here, here, all temporal bone. Then yellow we have sphenoid bone. I showed you sphenoid bone in the start. Here. This one. Okay, on a side you will also see sphenoid like this. Yes, this is one of the sphenoid. The remaining part is inside the orbit. You will see nasal bone, you know it. Maxilla, you know it. What is this? Lacrimal, yes. Then you have zygomatic cheekbone, and then you have parts of temporal bone. This is of course mandible. Okay. Here we have opening of the ear. External auditory meatus. Meatus means opening. External auditory meatus. We have internal auditory meatus. This is for conduction of sound air. Internal is for exit of nerve to go to brain. Okay? Not with us now in this picture. Then just above the meatus, this is meatus. Above the meatus we have this triangular area. Suprameatal triangle. Suprameatal triangle. Here you can see two processes. Mastoid. You can feel your mastoid. This is deep, you cannot feel it. Styloid process. I will show you once I am done with the theoretical part. Two very important sutures here. They have names. Pterion. P is quite silent. Pterion, asterion. The most important is pterion. Pterion. Where it is known as H-shaped suture. See H. H-shaped suture. Four bones. What are the four bones forming? Frontal, parietal, temporal, sphenoid. So between these four bones, H-shaped structure is pterion. What is the importance? Whenever you have a fight, this is the area to be damaged. The issue is just below it or inside it, we have a blood vessel. This is known as middle meningeal artery. It has two branches, anterior and posterior branch. So anterior branch is here. So anterior branch of middle meningeal artery is here. What is the real scenario actually happens? A student comes home after a fight. There is nothing. He is good. For a transient period of time, during the fight, he has some dizziness because of impact. He came home, he takes some food, slept, and after 4 or 6 hours, he is now unconscious. Why? Because the hemorrhage which occurred here It took 5 to 6 hours to develop and compress the brain. Understanding? So, this is a very important feature of Tyrion, and that period of awakeness is known as lucid period. Lucid period. When you have a hit, 1 o'clock, and 4 o'clock you are unconscious because of the hemorrhage inside. It's very superficial blood vessel, it can be damaged. So that 1 to 4 o'clock, 4 hour is known as lucid period. Now my question is, if the lucid period is bigger, the patient condition is good or bad?
Again?
If the lucid period is prolonged, more hemorrhage, excellent. If the lucid period is few minutes, it means very less hemorrhage and he is good. So one should always admit a patient with any head injury to exclude or do some investigation. So this is known as Tyrion, H-shaped suture here between the bones, you know. Then we have asterion between occipital, near the mastoid and parietal. This is known as asterion, Tyrion. It has no much clinical importance as this one. So anterior branch of middle meningeal artery is related to Tyrion. Am I clear? If you feel on the skull, you will find two lines here. Superior, inferior temporal line. And they come in contact with this arch. Zygomatic arch here. Zygomatic arch. This is zygomatic bone with an arch. So from here, this line will continue as a circular part and encloses, this is known as temporal fossa. This is temporal fossa. Okay? There is an infratemporal fossa. After this arch, below is infratemporal fossa. We have separate lectures for temporal, infratemporal contents and fossa. Okay. Again, temporal lines, superior, inferior, zygomatic arch, external acoustic meatus for the ear to enter the air, suprameatal triangle, small triangular area, mastoid process, styloid process. These are things to be identified on lateralis, norma lateralis.
Doctor,
Yeah.
is zygomatic arch part of temporal bone?
Yes, sir. Okay. This is the flat part of temporal bone. These are the parts from temporal bone. This is again a part of occipitalis on the back. See on the back. Two parietal bones, one occipital bone. Here, on a real skull or some plastic models, you will have lines. There are usually three lines. Highest nuchal line, superior nuchal line, inferior nuchal line on both the sides. Then in the center, in the midline, here we have an elevation. External occipital protuberance. I will show you on the models, don't worry. External occipital protuberance. And we have three lines. Highest nuchal line, superior nuchal line, inferior nuchal line. Then you can see some sides of mastoid process. Styloid process, yes, but very small here you can see also. This is, usually we study the skull without the mandible, so forget it. Sometimes, because we have separate objectives and separate locations for mandible. Okay, here we have the biggest foramen in the world, foramen magnum. The name is also magnum, foramen magnum. In exam, don't write please the esophagus passes through, okay? Please. What should pass through here?
Spinal cord.
Of course, the spinal cord, along with the covering meninges, blah, 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 blah. Okay. Other identification here, external occipital protuberance in the middle. Then we have a crest. This is known as external occipital crest line, just a line, nothing new. Nuchal lines, three. Highest nuchal line, superior nuchal line, inferior nuchal line. Where is This one, what?
External
External occipital protuberance, and this one,
crest.
crest. External occipital crest. Sometimes may be shown like this, no problem. Mastoid foramen. Here is the mastoid process. This is mastoid process. On the mastoid process, we have small mastoid foramen. I will show you, no worries. Again, mastoid will enter emissary vein inside a dural venous sinus or any other drainage area, giving a very bad possibility of infection entering inside emissary vein. Okay, then, okay, lambda, you know it.
Yes.
What was the previous in children?
Posterior.
Posterior fontanella. Fontanella. External occipital protuberance, asterion, pterion on the lateral side, and the same, nothing new here. Basalis externa. Basalis externa is this one. Okay, basalis externa is this one. Basalis interna is here. We will deal it with CNS interna because it's related to other structures. But if you identify outer, the inner is very easy. Don't tell anyone. I will give you some tricks and bonus points at the end. Okay, here we have, now this is norma basalis. Maxilla, this all. I have given you the same color with both. Maxilla, sphenoid. Now see, every norma you have sphenoid. Lateralis, frontalis, basalis. Temporal with mastoid process, styloid process, and other structures, of course, I will come. Occipital bone, foramen magnum. Okay, we have a line of takhayyul, imaginary line dividing whole of this into three parts: anterior part, middle part, posterior part. Anterior part, the boundary is from the incisors, the first line of tooth, till the last, roughly. So this is anterior part of norma basalis. This middle part, and the posterior boundary is anterior margin of foramen magnum. So here we have anterior part of middle part and posterior part of norma basalis externa. Now we will find structures here, here, and here. This is maxilla, this is palatine bone. Here, see this one. Maxilla, palatine bone. When you feel hard palate, this is the level. After you find soft palate is here. Okay? Now, you can appreciate some sutures here. What should be the name? Yes, interpalatine. Intermaxillary.
Maxillopalatine.
Yes, right and left maxillopalatine. Good? Understanding?
Yes.
So this is the structure in the hard palate. Again, we have sockets for teeth. What is a socket? An empty space where a teeth will come and fit. Tooth will come and fit. Sockets. I intentionally bring this broken one to show you some sockets after it. Okay? So here we have sutures or the demarcation of maxilla and palatine bone. Incisive fossa here. It's a triangular depression sort of structure like this, and inside we have two openings. Incisive foramen. This is incisive fossa. Inside we have incisive foramen 2. Incisive fossa and foramen. Passing related structure you can read. I can identify here. Then we have greater and lesser palatine foramen here. Greater, lesser. They are very good in a model. I will show you later on. this is mainly about the anterior of the. What is in the anterior? We have sockets for the teeth. Then we have incisive fossa. Then we have incisive foramen. Then we have two big foramen here, known as greater palatine, and two small lesser palatine. They have nerves, greater and lesser palatine nerves with them. Okay. Then we have, we have anterior nasal opening, aperture. We have a posterior nasal aperture. Sometimes you feel something is dribbling into your back of the throat. It's the nasal secretion coming like this. Okay. Here we have spine. This is the spine. Plus, here is a new bone dividing the nasal cavity into from behind. Vomer bone. This is known as vomer bone. Vomer bone. I will show you. No problem. So here is the spine. Posterior nasal opening with spine. Posterior nasal spine. This is trying to show you opening, but it's not very good way to show. Then we have two parts for pterygoid. You can identify here sphenoid bone. This is yellow sphenoid bone. Here you find one plate-like structure in a 3D. If I could make one plate, another plate. So two plates, and in between them pterygoid fossa. Medial pterygoid plate, lateral pterygoid plate, in between pterygoid fossa. I'm sorry for these bad names and your blank faces, but I will repeat it 10 times for you, no problem. Inshallah. This is what we have here, pterygoid. So medial pterygoid plate, lateral pterygoid plate, and pterygoid fossa. Actually, this is sphenoid bone. So it has small wing, lesser wing or greater wing, and then it has certain parts. It's not with you, the parts and everything. But you should remember the structure visible on the skull. Like in the orbit some area, like on the lateralis some area, like pterygoid fossa, like medial and lateral pterygoid plates. You should remember them. Good. What is this? The spring to hold it. It's not an anatomical structure. This one. This is to hold the mandible. So it's the spring. It's not an anatomical structure. Okay. What you find here?
The incisive. Incisive fossa.
Yes. Incisive fossa and foramen. Good.
Greater
palatine. Lesser palatine.
vomer bone.
Vomer bone.
Posterior
Nasal aperture.
Medial
Pterygoid medial, pterygoid
And
lateral,
fossa.
pterygoid fossa, nasal spine, sockets for maxillary teeth, hard palate, made of two bones, maxilla, palatine, interpalatine suture, intermaxillary suture, palatomaxillary suture. Clear? Life is easy? Huh?
What is the bone?
Here, this one. Can you see this line?
Yes.
This is the vomer dividing the nasal cavity in two on the back side. In the front, it is the nasal septum, which divides in two. It is contributed with vomer to continue on the posterior aspect. Are you clear now?
Yes.
Good. Okay. Then, now in the middle part. So we finished roughly anterior, some features of the middle. Now the remaining features of the middle are three very beautiful foramens here, oval in shape, like an egg, oval. Spinosum here. Try to remember the smallest, S for small, S for spinosum, smallest, spinosum. Oval shape, oval. Plus, here is another one, I missed the name here. Lacerum. If I was the scientist to name it, I should do something with medial. Because it is not the medial, it's medial, actually it should be labeled as something medial. But we have three very beautiful foramen here: ovale, spinosum, lacerum. Then we have spine of the sphenoid on the model. I will show you. Don't worry.
What do you mean by F-ticker? F-O-5?
Foramen.
Oh.
Foramen. F for foramen. Foramen, ovale, spinosum, and lacerum. Foramen ovale, formula for the contents. MALE, mandibular nerve, accessory meningeal, lesser petrosal nerve, and emissary vein. Try to remember them. Okay. Here is the thing known as carotid foramen. This one. Many books says this, labeled this as carotid canal. Why carotid canal and not foramen? I told you foramen is a structure from where a structure passes like this. Canal, of course, it has two ends, but the carotid canal is like S shaped. So here is the opening, this one, and if you pass a soft structure wire or something, it will cross and come inside the skull. So that is the reason it is known as carotid canal. Okay? They say foramen is like through and through very quickly. Canal has some path. So many of the book you will find saying carotid canal rather than carotid foramen. Sometimes, some books. Then, now, can you identify certain structures here?
Yes.
Incisive, greater palatine, lesser palatine, spine of the nose, vomer. On this side, zygomatic arch. Good.
Foramen ovale.
Oval,
Spinosum.
spinosum, lacerum. This is some extra thing, not with us. Some real bones, they are very brittle and they break sometimes. Give you an extra beautiful foramen. So don't believe in them. Okay? Then we have carotid here. This and this. See, in the foramen, you can see the black on the behind. But here you cannot see the black. Why? Because it has a path inside. So carotid canal. Am I clear for canal now? Okay. Here. Lacerum. Spinosum, ovale, spinosum and lacerum. Here, like same. So foramen lacerum. In the lifetime, foramen lacerum here is covered with a cartilage. So here is the story you can read. Okay. Here we have auditory tube. You know the auditory tube?
Yes.
It has a pathway here, a depression, auditory tube. Groove for auditory tube. Okay. External auditory meatus should be here. One structure here. I missed the arrow. Carotid foramen. Just behind the carotid we have a very big jugular foramen. Internal jugular vein is here, the main content. Then between the styloid process, this one, and mastoid process, this one, we have a beautiful foramen here. Stylomastoid foramen. Stylomastoid foramen. Okay, for facial nerve and other associated structure, but the main is facial nerve. It is the facial nerve trapped here when you have some facial nerve palsy, deviation of the mouth and dribbling from the eye and other feature you will learn with time. Now, again, ovale, spinosum, lacerum, Carotid canal, jugular. Good. Now we are left with the last part. Everything I repeated and the contents you can do. Okay. Another thing on the side of the norma bezalis externa, there is an arch. Now we are getting out of the central part, outer part, arch, zygomatic arch. If you come and see really a bone, you will find a depression. See, it looks like a depression. And here is an elevation. So, zygomatic arch, articular eminence, and this is for making the joint with the head of the mandible here. Here, my head of the mandible will fit here, so that movement can occur on the mandible. Otherwise, in the skull, there is no movements between the joints, because in adults, they are sutures now, fixed. In children, yes, there can be some molding or something. But in adults, the only mobile joint here is temporomandibular joint. Why temporo? Because with the temporal fossa, near the temporal bone, mandibular head of the mandible makes a joint, temporomandibular joint. Sometimes we write as TM joint, temporomandibular joint. In a real skull, you will find a depression for the head, arch, and you will find an elevated part. Maybe some variation, big or small, no problem. The posterior part, now we are coming towards the occipital bone. Occipital bone is even here, this one and this one, including two heavy condyles, like here, like here, to make the joint with first vertebra, atlanto-occipital joint. Atlanto-occipital joint. So the first vertebra is fixed here. First cervical vertebra, the name is atlas. This is known as basilar part of occipital bone, the whole. In this part, we have a small tubercle here, pharyngeal tubercle. What is pharyngeal tubercle? It is connected with pharyngeal muscles. What are pharyngeal muscles? Three, in a shape of three cups or glasses, one in the other. If one contracts, the other contracts, and we start, the movement of peristalsis starts from here. It goes into whole of the intestine. It also helps in swallowing. Okay. This is known as pharyngeal tubercle related to pharyngeal muscles. Okay. The biggest foramen in the world, foramen magnum. Except esophagus, everything can pass. Like spinal cord, medulla oblongata in the uppermost part, spinal accessory nerve, three meninges, dura mater, arachnoid mater, pia mater. Three meninges of the brain and spinal cord. Coverings. Dura mater, the outermost, the thick. The arachnoid mater in between. The pia mater very close to the nervous tissue. And there is CSF between in the subarachnoid space. So subarachnoid space is where arachnoid matter and pia matter in between subarachnoid space. We have separate lecture, don't worry. Here you only have to identify foramen magnum and the contents. Okay. Occipital condyles make joint with atlas, atlanto-occipital. The type is ellipsoid synovial joint, atlanto-occipital joint. Nothing new here, except with this condyle, we have two related foramen, one in front, one back. One here in front, one back. Here, one front, one back. I will show you in the specimen. They are known as anterior condylar canal, posterior condylar canal. Or this is sometimes known as hypoglossal canal, the front, because it crosses, it gives you hypoglossal nerve. Anterior one is known as hypoglossal canal. Mastoid process, I told you many times. Styloid process, between the two, stylomastoid foramen. stylomastoid foramen. Yes. Now everything in one plate. I hope you will identify all of them. Inshallah. Let me help you. Incisor foramen, fossa and foramen, greater palatine, lesser palatine, posterior nasal aperture, apex or spine, vomer, oval, spinosum, lacerum, carotid canal, jugular, anterior condylar, posterior condylar, and stylomastoid. Life is easy. And good. Here is a table. What contains what? What contains what? And thank you. Last year or in between, I have made a video on all these foramina. In my video channel, this is the link. Here you can scan it. I will give you later on. Scan it. You will reach and find the video related this 5 to